Good evening and welcome to this session. So, welcome to a brand new year 2025. Well, before we start, let's just wait for the others. Yeah, I can see people are just logging in. Yeah, okay. Okay, I think today I felt like just giving you a message. The one thing that I wanted to say this year is aim for the moon. If you miss, you may hit a star. Well, I feel that it resonates with a lot of you. Last year would have given you a lot of disappointments, a few setbacks, and some things that you didn't even think would happen. But that's not a reason for you to just lie there, wait for something to change and something to happen. You need to take hold of yourself, see that you're able to march forward, because we all have our goals, but reaching our goals is pretty difficult, whether it's for you or for me. We set our goals. Some of us set our goals as soon as we complete college. Some of us wait for a new year. Those of us who wait for a new year, we realize that, yeah, a new year starts, we need to have goals, and then maybe a month later or maybe half a year later, you realize that you're reaching nowhere, you feel disappointed, then you just want to give up. People, I would say, don't give up on yourself, have faith in yourself, see that once you've set a goal, you have to walk towards it. It's that inner energy that has to make you walk. So sometimes you come across these negative energies. I would say those negative energies could be someone around you telling that you can't do it. It could be certain circumstances that just comes your way and you realize, okay, maybe I'm not ready for this. But once you set a goal, you know you can walk towards it. Don't allow people to tell you that you're not up to it, you're not capable of doing things. Don't let them do that, because you have to have a hold of yourself. You should have the key to your inner mind, your inner energy, your positivity. See, we all get up in the morning with dreams. After seeing dreams, maybe those dreams might not be as colorful. It might be sometimes you might have had nightmares. Doesn't matter. You might. It's not every day that you have positive energy. Sometimes a little bit of negative energy does creep in. But try to be positive. See a positive side to everything. Keep away the negative energy. Get away from the negative energy. So when you start a new year, like I said, aim for the moon. Even if you miss it, you might just strike the stars. So I guess some of you must have tried OET last year, might not have cleared. Some of you would have got a clubbing score, want to try it again, but are quite afraid what will happen if I don't clear. Don't bring that don't in your thoughts. That don't is what pulls you back. Just move forward. You don't have to be worried if, what if it doesn't happen? Why don't you think, what if it happens? Why don't we think positive? I know there are a lot of people out there thinking, well, OET is not my cup of tea. Well, OET is no one's cup of tea unless you try it. You have to give a try, because it's better to try and fail than just sitting there and thinking, oh, I can't do it. Because who knows, with all the help that you have, with all the guidance that you have, you might just clear OET. It's not might, you will clear OET. Have that faith in yourself. Think that you can do, because everything becomes possible when you think it is possible. It's not that when you keep it aside and think, okay, maybe someone will just come by and help me. Nobody is going to help you. You have to help yourself, because as the saying goes, God helps those who help themselves. So you have to take the rein in your hands, go forward. Because once you have stepped out, you thought you want to do OET and you stepped out and you are trying for it, nothing should stop you. You must be able to go forward, do it. Now, it's not just about OET, everything in your life. You have a goal in life. Get up in the morning with a goal. You might have daily goals you might have monthly goals and even yearly goals. Think what your goal is, set a goal, think about it, and every day, be positive, think about it, work in a goal oriented manner. You could have posters or charts stuck in your bedroom, so that when you get up in the morning you see that first thing, something that just brightens you. It might be just a picture of the London Bridge. Seeing that in the morning, seeing the London Bridge in the morning, a picture of it, you might just be, you get positive. You think, okay, that's my goal, I want to reach London. I've seen a lot of students of mine reaching and then say, ma'am, this is where I wanted to be, and this is where I am today, I'm so happy. So you might never know, what inspired you. Think about all those countries, all those places you want to visit. Well, that would be possible only if you do a OET, clear it, and go somewhere. So aim high, aim and get that aim, reach your goal. So I wish you all the best. I wish you have a very successful 2025. And with that positive note, may I start on today's session. Well, I think most of you have joined. Great. Okay. Happy New Year to all those who joined just now. Yes. And so we'll be going on to today's session. Today's session is on the last two criteria, which is organizational layout and language. Well, over the past 3 weeks, we did the other criteria, which was purpose, content, conciseness and clarity, and genre and style. So today we'll be looking through organization and layout and language. Okay, so today we'll start with organization and layout. As you all know, organizational layout is marked out of seven, and we have certain tips that I want to give you, certain strategies on how to improve on these two criteria. So, organization and layout, we go to the first point of it, which is organization and layout and what needs to be done. Well, the basic rules for this criterion is write in clear paragraphs, use the correct letter layout, ensure that the important information is easy to find, and logically group ideas together. Now, these pointers should be looked into, but we'll go one by one. So, as I mentioned in my previous session, our information use usually is segregated into relevant, semi-relevant, and irrelevant information. So once you get your case notes and you have segregated it in this manner, the relevant information that is already chosen by you needs to be organized properly. So that's the next step. So once you've segregated information, you organize it properly. This requires the information to be presented logically. Each case note actually represents the outline of the story of a patient. So, why am I saying it that way? Is because that particular letter contains the presenting complaints of the patient, the history, and finally what needs to be done. So, this outline needs to be made into a proper story with a proper order. So, it depends upon the person who's going to read it. So, you give it an order, keeping in mind who the recipient is. To make this into an interesting story, think like the recipient. So you would know, that way you would know what order the particular person needs the story in. So it gives you an idea on how to formulate it. So to make this a little more clear, or to bring clarity to what I said, I would just like to take you to a clinical setting. So all of you, if you've worked, you know how you, once your duty is over, you do a handover to the next nurse who comes in. So you brief the nurse on the patient who is there. So say I just take a simple case. Say you have a patient who comes to you with a tummy ache, and the doctor asks this patient for details and concludes that it is a main digestion problem. So what he does is he gives her a medicine and sends her back. A few hours later, she comes back with severe pain. So when she comes back, he realizes that the medicine hasn't worked. So he's obviously going to send her for a scan and then realize that the problem is actually an inflammation or say an infection of the gallbladder. It requires an immediate surgery. So at this point, you have just started preparing the patient for the surgery and your duty is almost over. So the next nurse walks in. So as the next nurse walks in, you're going to hand over the patient. At this point, you would be telling the important details to this nurse. So how would you say it? Well, you would actually tell the nurse that a surgery has been um, told for this particular patient and you have like partially prepared the patient for the surgery. That is, you have told the patient he or she has shouldn't drink or eat till the surgery is done. So you have told that, and maybe sometimes you would have just started the patient on an IV drip, and now you're handing over this patient to the nurse. So you have what you will be telling him is that telling the nurse is that you tell the nurse that this is a patient, this and is slated for a surgery later. You have just prepared the patient, and you will be telling about the earlier medicine that was given, which was not good enough, and that's why the scan was done, and that's what and how we reached the conclusion that this patient has an infection. So the nurse knows all this. Then you will also be telling the nurse that maybe the patient has other conditions. You will be telling that comes in the history. You will be telling, for example, maybe the patient has high blood pressure or high cholesterol. So you will be telling about that. And lastly, I will tell the nurse what the nurse needs to do thereafter. Probably prepare the patient further for the surgery. So do everything for the surgery. This is how you have handed over the case to the next nurse. So this nurse has got all the details from how you have told her. So this is what you're going to do in a letter. When you hand over a patient, this is what. If it comes in a letter form, you need to include all this. Now say the surgery is over and the next day you come back to take over the duty. This nurse to whom you had given your patient tells the information about the surgery. So she again tells you about how the surgery was successful or it was done, and then what is the patient now on and how is his condition. She doesn't have to tell you about the earlier conditions because you already knew the patient. So this is how we, according to the recipient, matters go. So I hope you understood that portion of it. And this is how the case will be written. So when you're writing the case note, if the other nurse is going to give you the case to you, she will be writing about how the surgery was successful and what needs to be done thereafter. So basically, we would have something like this for this patient. Uh, Say so if this nurse were to hand over this patient to you, she would, and it was through a letter, it would be written and writing to update the present condition of Mrs. X who has undergone the surgery. She requires further management. So everything is clear here because I have already seen the other patient. I know about this patient. I just have to know about her present condition. So there we have made it very clear. Again, I would like to tell you that this order is not just for the paragraphs, it is also, going to be for the sentences. Yes, before we come to that, I just want to make a thing clear with you. A fact is that, say, this order which I told, we say it as a chronological order. Now we have something known as a reverse chronological order. This would be slightly different because say you have probably a patient who's come to you. The same patient. See, supposing when this patient came and the patient we just diagnosed with this condition, and probably you're sending at this point, once this condition has been diagnosed by the general practitioner, he wants to send this patient to, say, according to this condition, we are going to send this patient to a gastroenterologist. how would you write a letter to the gastroenterologist? So at this point, when you're sending this patient to the gastroenterologist, it is for an immediate assessment because the patient has infection, it's really bad, and we need an immediate assessment. We're sending to a specialist, and at this point, you're going to be writing about the present condition first, and then give about what was done earlier. So I just want to show you how that goes. So I would be sending a letter something like this. The body paragraph of that letter would be: Today, Mrs. X presented to hospital with severe abdominal pain. Her CT scan confirmed infection of the gallbladder. Earlier, Mrs. X presented to hospital with a stomach pain and she was prescribed with an analgesic. 2 days later, she re-presented with a persistent stomach pain and she was advised to take a stronger analgesic. So here at this point to understand, we have started with the latest information or the most recent visit and then gone back to the first and the second visit, and that is why we say it as a reverse chronological order. So now we have learned two orders. There's a chronological order and a reverse chronological order. So, and from this we understand that according to the recipient, we change the order and according to the seriousness or gravity of the issue. So we have realized that we have two orders and it changes according to the situation. Okay, like I said, we have sentences also that we have to put in order. We can't just put any sentence we want first and second and third and so on. That doesn't happen. You lose marks in this particular criterion. So what you actually have to do is that see what is the order of sentences. So first we have already segregated, we have taken the relevant information. Then you, once the relevant information is taken, you first put the sentences into order. Then take these sentences, put them into the right numbered paragraphs. So say we have, this would be really useful, especially when we're doing a history. Say you have the personal background of a patient, the social history, and the medical history. And what you do is you pick up what's relevant, then you number it. Like you say, this is what has to go first, maybe this is second, and this is third, and so on. So, to give you a better idea about this, I just want to give you an example. So, let's go into that example first. Yes. So, this is about a patient uh, who underwent a colostomy. Well, I'm sure all of you know what's a colostomy. So, after this person was diagnosed with colon cancer, this patient has undergone a colostomy, and I want to write to a nurse to maybe for further management. But when I write, I need to write a complete letter. So I have certain information. As you can see, we have information regarding the personal background. We have social history and medical history. But in the personal background, we have quite a bit of information. I could say that he's married, wife has high cholesterol, has two sons, both abroad, likes fast food, prefers beef and mutton. Now, in the social history, we have information like have two brothers, older one hypertension, younger brother diabetes, mother diabetes, father died due to colon cancer. And the last is medical history, which says has had hypertension 2020, which means the patient has had hypertension since 2020. Okay, and underwent appendectomy in 2021. All this is the information that is given here. Now we need to choose. So, like I said, we choose. So, when we choose from the personal background, I would say the point about likes fast food is important because, mind you, this was a colostomy case. So, likes fast food is important. Prefers beef and mutton, yes, important. And maybe we could put the point of the person is married. Yes, that's sort of semi-relevant, I could say. Then we go on to the social history. And in the social history, We go through all the details, and I feel the only one that's important. Yes, one of you have answered. Yes, father died due to colon cancer. Exactly. So that's important. Then the medical history. Yes, nothing is important. So now we have chosen the information that is required. Okay. Once we have chosen the information, now we have to give an order to it. So I would say the part about he liking fast food, beef and mutton, all that is important. Even the father, his father died due to colon cancer, is important. So you could include that, and the part about that he's married. So this is how we've organized the information. Mr. X prefers to eat fast food and likes eating red meat. His father died due to colon cancer. Mr. X is married. So now we have organized the information according to its importance. So understand the fact that even if you have included all the information the reader needs, but not in the order they would wish, then we will not have demonstrated this criterion correctly, which means we will lose marks. Basically, that's what I want to tell you, you lose marks. So what you need to do is follow these two rules. Make a paragraph plan after grouping sentences appropriately. See that you group your sentences and then make a paragraph. Don't just start. I've seen a lot of students first start writing their letter. Halfway through, they realize that they did not group it properly or the order was not how it should have been. Then they erase the whole matter and then restart. You're wasting real precious time. This, I wouldn't really suggest that. So please see that you first give an order, make it into the right order, and then start writing. That gives you enough time to proofread your letter. Because mind you, don't proofread your letter, you're bound to make some mistakes, and the mistakes remain, and you lose marks. Even a small gender change can just get you a C. So please be careful. So that's one thing that is very important. Secondly, try avoiding overly long paragraphs because when you have too long paragraphs, I would say even the reader feels quite what do you say irritated seeing such a long paragraph, so many things written, and most of all, for your exam, you might lose marks because I'm sure you would have included a lot of unnecessary matter in this. So I think you better watch out. Don't make it too long paragraphs, and try dividing it accordingly. Don't just leave a paragraph in the middle and then start and don't do that. Complete a paragraph. See where you can make the cut and then go to the next paragraph. Okay, so uh, before we go to the next part of the criterion, which is layout, let's go for a short break and see you after the break. Hi, so welcome back. I'm Dr. Mary Binoy and I am talking to you from Envertiz Academy. So we here at Envertiz give you coaching for OET and PT. So you come to us. So let's continue with our criterion. So we have reached it is completed organization. Now with organization, the criterion that was there was layout. This means the information before and after the letter. The layout means the information just before and just after the letter. That's what we start with. So you must be familiar with how we started letters when we did those letters at school, the formal, informal, and all that. We started with the date. So we have a similar one, but it's somewhat slightly different. So I think it would be good to unlearn that and relearn this. This is something that you need to learn in life. Also, once you feel there are mistakes made, unlearn it, relearn the new thing. Okay, so this is how it goes. The letter starts with a date, which is the date of discharge or today's date. Usually, the present day case notes have a heading which starts with assume today's date is such and such. So you have the date given there, it's very easy for that. Then that is followed by the recipient's name and address. Um, this information, the recipient's name and address, is given in your writing task. So the order for how you write the recipient's address is you write the full name of the recipient, followed by the job title or designation. Next is the name of the institution or office, followed by the street number and street name. And last you have the town or city. After this, you write the patient's name and age or date of birth, and last is the salutation. I just want to give you the way how we do this, a format for this. You could jot it down. So, like I said, you start with the date, full name of recipient, designation, address, leave a line, then you write your greeting, so salutation, leave a line, and then you go to the patient's name. So, you write RE, which stands for reference, patient's name, comma, age or date of birth. Now, I just want you to write one yourself. So, say we have information given like this. You have the information, that is, you have your writing task that's given, and in the writing task, this is the information that's given. Using the information given in the case note, write a referral letter to Mrs. Andrea Thomas, the nurse in charge at St. John's Hospital, number 6421 Rose Street, Kingstown, and you have the date at the top. It says assume the date is 5 June 2024. The patient's name is Maria George and the age is 52. Her date of birth is 2275. So this is the information that has to be taken into consideration when you write the layout. So now I'm giving you the information. I want all of you to try writing that down as a layout. I'll just give you a minute so that you can just write it. Yeah, and I want you to type it back to me so that I know, I get to know whether you understood what I just explained to you. Yes, I can see all of you have just tried your hand at it. Yes, correct. Yeah, you start with the date, so it's 5 June 2024. Yeah, leave a line and then you write Mrs. Andrea Thomas, nurse in charge, which is the designation of that nurse, St. John's Hospital, number 6421, Rose Street. Next line, Kingstown, leave a line, and salutation, which is Dear Mrs. Thomas. So you always use the second name. So it's Mrs. Thomas, and leave a line, write the reference, which includes the patient's name, which is Miss Maria George, comma, date of birth, 2nd February 1975. Now, we had both. Actually, we had the age and the date of birth. In a case like this, when you have both, it's always preferable to write the date of birth. This is because date of birth is more accurate. Let me just explain it slightly. The thing is that when a date of birth is given, it means you can actually count the age to the day. That is, when you say the person turns say 25 in a particular year. So in one whole year you'll be saying 25 years. Whereas when you have the date of birth, you would be saying person is 25 years and 1 day, 25 years and 2 days, and even be 25 years and 364 days. So you have it accurately when you have the date of birth. So preferably you write the date of birth. So now we have done that. Remember that the word limit does not include the date, address, greeting, or the reference. So these are excluded from your word limit. Next, the end of the letter has a closing phrase. I hope you remember the different phrases that I given you for the last class, for the last session. You mentioned I had given you quite a few of the closing phrases. And after this closing phrase, I just give you an example. If you have any further queries regarding Mr. So and so, please do not hesitate to contact me. That's a closing phrase, example of a closing phrase. followed by the closing phrase. You end the letter, you leave a line, and you end the letter with yours sincerely, if the recipient's name is given, and yours faithfully, the name is not given. So, correctly, appropriately for this particular letter, you would be using yours sincerely because the name of the recipient, that is Mrs. Andrea Thomas, is given. So, you will be using yours sincerely. So always remember that there are no templates and no set way for letters. Approach each letter individually. Try not to compare one letter with another because each patient is an individual and therefore unique. Just like you and me, we are unique. Each of these patients are also unique. So they have a list of complaints, and these symptoms of patients stem from different reasons. For example, say you have two patients who have come to you with hypertension, and you're just investigating, you would realize that these two people have hypertension because of two different reasons. So obviously, you would be treating them differently. You would be treating them in different manner. The management will be different. So and how things turn out also would be different. So this is why I say don't compare one letter to the other. Don't say that that letter was written in that manner, so I just followed it. Don't do that. Read each case note, understand, then write it. Okay, that brings us to the last criterion, but the most important, I would say, because this is where you make a lot of mistakes. That last criterion is language. Again, language is marked out of 7, and language basically looks into four uh, main factors, namely grammar, vocabulary, punctuation, and spelling. So these are the four components that will be looked into. So let's start with grammar. I can just see your faces when the moment I said grammar. Yeah, let's make it quite simple. Grammar structures the language. I would always say that grammar is the backbone of any language and so definitely important. For instance, say you have a case note and it says live alone. Okay. Now, how do you grammatically put that sentence correctly is he or she lives alone. Okay. Similarly, say you have this case note. Now, 2 tablets daily. I can't just write this, copy paste it into my letter. So I give it a form, make it into, convert it into a sentence, and write he or she, according to the gender, he or she is currently taking 2 tablets daily. Okay, so this is how you use your correct tense according to the situation and get the grammar right. Okay, so we go on to the next uh, part or the next factor, as I said, which is vocabulary. It shapes how you communicate with the recipient of your letter and in speaking with your patient. So, vocabulary has different parts to it. Let's go through those parts. One is clarity and precision. Use the appropriate medical terminology and phrases. Now, what did I mean by that? Is that say you're writing to a medical professional, you could write it as cardiac arrest. Whereas, say you're writing to an allied health professional, preferably you could write it as a heart attack. See how what I meant? Use medical terminology and phrases accordingly. The next is professionalism. So, professionalism is your letter should show that you are knowledgeable and capable of engaging in professional dialogues. For example, say in your recommendation, you have this particular thing, it says check wound, apply bandage. Now, you can't just give it that way. Check wound, apply bandage. You need to make it sound polite. So you would say, kindly check the wound prior to applying the bandage. So that's how you make it. Um, don't change the meaning of the information given in the case notes. This is usually, most of the time it's seen when you use connectors. For instance, say you have a case note which says medicine taken, condition improved. Okay, and you don't know these connectors properly, you don't know where to use them or what should be used where, and you write the sentence as she took the medicine, however her condition improved. Well, that's wrong. You will get wrong for that, and that's a mistake. So what you should have instead written was she took the medicine, therefore her condition improved. So see, you use the wrong connector and you lost marks. So if you don't know where to use your connector, please don't use them. But I would say please learn how to use a connector, because in case you want to use it and you want to use it during the exam, that's not the right time. So always practice, see that you are okay with it, and then write it, go ahead with it. So, as I always tell, we here at Envertiz Academy, waiting for all of you. Please come and join us. We're here to help you. We see that you write letters daily. We help you with your letters. Once your letters are written, we correct it, and then we make you see how you can learn from your letters. Because every letter, as I said, like a patient, is unique. Okay. So, as I said, the sentence has been corrected. Then the last one in your vocabulary is, sorry, the second last one is engagement. Effective vocabulary can make your writing more engaging. For this, avoid jargons, especially when writing to a non specialist or an allied health professional. For example, instead of writing hemiparaplegia, when you're writing to an occupational therapist, it would be better if you could write paralysis of the right or left side of the lower half of the body. So you're giving it in easier terms, and that's better. Next is you must vary your vocabulary, which means don't keep repeating words, because that just adds to the monotonity of the letter. It just makes it monotonous. For example, instead of repeatedly using the word pain, you could use words like discomfort, ache, or soreness. Okay, so and then in grammar we have one more, and that's the next one in your sorry not in yes, for the next point in language, what we have is punctuation. Like I said, we had grammar, we had vocabulary, and now we come to punctuation. Punctuation adds clarity to your writing. So, punctuation marks are very important. The best example for this is the introduction. Okay, when you're writing to an introduction, say you're referring a patient who has undergone a surgery, you just simply write it as um, I'm writing to refer Mr. X, who underwent a surgery. He requires further management. See, where I've used a full stop and not used a comma also. So now if I want to write about a patient who's a known case, if it's a known case, you would write writing to refer Mr. X, comma, a known patient of yours, comma, who underwent a surgery. He requires further management. See here, I have put the commas, which means that whole phrase, even if taken out, the sentence stands perfectly. So that means that you have to use commas. So see how I effectively use the punctuation marks. Okay, and that brings us to the last but not the least important of all these, which is spelling. Yes, I know all of you think spelling is very easy. You can just write everything. That's what even I had thought about before I started with teaching students language, English language. I had this idea because now I see a lot of different spellings. For example, February comes with a V in between. So I'm just astonished. How did the V get in? So most of the students say, "Ma'am, we write it just like how we pronounce it." But most of the words in English is not according to the pronunciation. And so words like, simple words like, for example, beneficial or appreciated, sincerely, all these words, spelling mistakes, yeah, you make them and you lose marks. Also, when using proper nouns, that is the names of persons and places, start with a capital letter. For example, say United Kingdom, the U and K are capital, not small. Similarly, when you're saying medicines names, see that you use the alphabets according to how it is given in a case note. For example, say it starts with a capital letter, use a capital letter when you are also writing. When you are writing it in your letter, use a capital letter. If a capital letter is not used, don't use, because we have rules for that also. So that's it. So I think we have come to the end of the criteria. So I just want to answer some of the questions that had come up in the last sessions. Um, that's the previous sessions I got some of these questions. Just want to answer it. And I would like to also tell you that you have any queries, anything that you want to ask me, please do comment on this so that I know what you want and what is it that you would like to know. Well, one of the query that I got is whether I could speak in the mother tongue. That's Malayalam. I wouldn't recommend that. One of the reasons being that we have a pan-Indian audience, so I would want everyone to make sense of what is being said. And most importantly, I would say to learn a language, you have to hear that language. So the more you hear English, I'm sure you will get a hang of it, rather than sticking to a mother tongue, because you'll have to go abroad. You're going to speak in English. You're going to go to one of the English-speaking countries. So obviously you need this. So try learning it. I mean, it's good. And I don't think I bring in very tough words, and I'm ready to explain all these things. And I brought it down to examples and everything. Okay. The next doubt is someone had just asked me that how do you know what synonyms to use? Well, that comes with practice, because when you write letters, when you're practicing, you use a particular synonym, and the teacher who corrects would tell you, okay, this synonym cannot be used in this context, or where can you use it? So she would help you out. So that comes only with practice. I can't tell you, what synonyms to use, because it's all according to the its context. So according to the context, according to the situation, synonyms change. Now, someone has asked me, like, how's the purpose of the letter, ma'am? Because they asked, ma'am, when I've written everything. I mean, the whole, the first introduction paragraph was perfectly right. The person just ticked it right, and still I haven't got my 3 marks. Why is that? Well, purpose has two factors to it. You have to have written everything in your first paragraph and explained it effectively in your rest of your paragraphs. So only then will you get a complete 3 marks. So what it basically means, your entire letter should be error free to get a complete 3 marks. So I hope I'm clear about all this. So you have any queries, anything that you want to ask, please do comment, and we'll get back to you. You want to contact us, I hope you know where we are. We are the Envertiz Academy. We are at Kochi, and we have classes. We have listening labs, and we do individual correction for all the modules, all 4 modules, and we have mock tests. So you just come and join us and see astounding results. So as I told you in the beginning, don't give up. Please keep trying, and see how your OET scores just soar up, and I'm sure you'll all get a full day. So I hope to see you all here. I wish you a wonderful 2025. Hope to see all of you go abroad, and we will meet for the next session. Until then, take care, have a great time, and see you. This is Dr. Mary signing off. Bye.